clinical trials, the importance of diversity, community engagement, and sickle cell disease education. Y'all, we have some incredible, incredible speakers for you today. I met them all out there. First, we have Dr. Priscilla Pamu, a national leader in clinical trial diversity. Yeah. Dr. Pamu leads clinical research at Morehouse School of Medicine as the Associate Dean for Clinical Research and Executive Director of the Clinical Research Center. Her work focuses on fostering trust, collaboration, and equitable participation in medical research. Everyone, Dr. Priscilla Pamu. Yeah. Next, we have Casey Boynton, and I told Casey, we got to talk, girl. The Global Operations and Community Partnerships Lead for Diversity and Inclusion in Clinical Trials at Sanofi. With over 15 years of experience, Casey is known for her dedication to health equity and patient diversity in clinical trials. She has led transformative campaigns to ensure equal access to life-saving therapies for patients from all backgrounds. Everyone, Casey Boynton. We also have Constance D. Benson, an American actress. You got to hear this one. Constance D. Benson is an American actress cured of sickle cell anemia. Yeah. Cured of sickle cell anemia through a bone marrow transplant. She frequently speaks at events advocating for bone marrow transplants and promoting sickle cell anemia awareness. Everyone, Constance D. Benson. Additionally, everybody, we have Chris Lundy. Chris Lundy is the academic advising manager in the School of Aerospace Engineering at Georgia Tech. Chris oversees the undergraduate operations of the aerospace program and is an advocate in the sickle cell space, being a bone marrow transplant recipient, soon to be sickle cell free for 25 years. Look at them, y'all, looking so good, looking awesome. And our moderator for this session is Victoria DiBiaso, MPH, BSCN, the global head of Patient-Informed Development and Health Value Translation of Sanofi R&D. Victoria has over 25 years of clinical research experience and has revolutionized R&D models by establishing trial sites and patient networks, ensuring therapies are co-developed with patients and stakeholders. Everybody, a very special thank you to our platinum sponsor for this session, Sanofi's Diversity and Inclusion in Clinical Trials team. Please, everyone, join me in welcoming our panelists to the stage. Well, y'all are up here already. How y'all doing? Good to see you. Take it away, Victoria.
Hello, everybody. And I think if we could get a QR code up on the screen, if we can, there it is. If we could get a little audience participation, we'd love that. We're running an anonymous survey just to understand how much people know about clinical trials and different types of questions you may have. So this is a QR code you'll see now for the start of this discussion, and then we'll have another one, hopefully to show that maybe we all learned a little bit more about clinical research and the importance of it. So thank you all for coming to this really important session. I'm not sure how many people in the audience are familiar with clinical trials or have participated. If you're open to it, if you've been in a clinical trial, can you raise your hand? Woo! Love it. Love it. Thank you so much. You really are fueling the hope for patients around the world through your participation. For those that are not familiar with what is a clinical trial, these are scientific research studies where we evaluate how well a new potential medicine, how well it works, and how safe it is. And as you can imagine, it's important that it's tested in the diverse and representative patient population. And that it goes from your sex, your race, your ethnicity, your age. I don't know, ladies, but I can tell you, post-menopause, my body does not respond to things the way it did before. So it's important that we really do have everybody equally represented. So I'm going to turn actually to Casey. Casey, maybe in your role, and I'll let you describe it. First off, thanks for what you do. It's really amazing how you work with communities. to make sure that people are represented. Can you describe why diversity in clinical trials is so vitally important?
Yeah, absolutely. And I'll actually start with a personal story. A few years ago, my mom had a pulmonary embolism and found out that she had blood clots. And we didn't know that she had a history of DVT because a lot of times in our community, we don't know our medical history. We don't know our family's medical history. And so I went to her doctor's appointment and the doctor prescribed her a drug. And I said, well, why did you prescribe this drug? He said, well, there's a couple options on the market and I'm just testing this one out. And me doing what I do, I said, well, show me the clinical data. And I looked at that clinical research study and it was 97% white and 67%, well, 66% male. So I said, well, how do you know that this is gonna work on my mom? He said, I don't. And that hit it for me. That really fortified why it is that I do what I do. Because the reality is that if we aren't participating on clinical trials, we're not then able to know whether or not these drugs are safe and effective for our own community. And when it's your mom sitting there who's struggling for her life, you don't know how to respond. And, I'll go to the punchline and tell you that we had to switch drugs because that one didn't work for her. And she had major adverse reactions. And so at the end of the day, it's not, bye-bye, sweetie. It's not just about, our individual health and why we participate on clinical trials, but it's for our future. The generations that are going to come beyond us to say, hey, we want to make sure that these drugs are effective in our community. And we want to make sure that when we're sitting in the doctor's office and that doctor is saying, hey, we want you to take this drug, we can make an informed decision about whether or not we think that's the best option for our care treatment. And so at Sanofi, we really are committed to thinking about representation. We're really committed to working with the community to do that. So instead of sitting here with our lab coats, we're in conversations with the community and saying, what's most important to you? And how do we make sure that those things are how we conduct clinical trials? And we're hoping to change the way that that's done. And hopefully, the folks in this room will be a part of that. So.
Thanks, Casey. So Dr. Pimo, turning to you, sickle cell disease unfortunately disproportionately affects the Black community and even more so among women in the Black community. Is it possible for you to speak a little bit about what is sickle cell disease and some of the therapeutic options that individuals have today?
Sure. Can you hear me? Okay, great. Who in this room has not heard about sickle cell disease? So it's pretty common, and we know that it's a genetic abnormality. So it's a disease that's spread from changes that happen in our genes. Before, let's say, 15, 20, 25 years ago, all we could do was wait for something to happen and try to manage it. That something could be they're having a lot of pain, they're having crises, that's what they're called. They're having pain, their blood counts are dropping, any number of things. And all we could do in medicine was just treat it, the symptom, versus treat the problem. Some of the new things that are exciting in sickle cell disease therapy in terms of medications, there are medicines. So for those of you who are familiar with sickle cell disease from when the child is born, typically a child doesn't show it until they're maybe 9 months old. That's when their hemoglobin transitions. Hemoglobin is that thing in your red blood cell that helps carry oxygen around the body. So there is a type of hemoglobin known as fetal hemoglobin. There is sickle hemoglobin, but fetal hemoglobin is high, when you're born, and then it tends to taper off. And the other types of hemoglobin then become predominant. That's why for most people with sickle cell disease, the first showing would be maybe when they're about 9 months old, is when they start to show signs of it. And so some of the newer medicines that are on the market currently that are addressing some of these challenges, try to increase the proportion of fetal hemoglobin that the person has. So it's not just waiting for them to have a crisis, but shifting the types of hemoglobin that they present with so that they're not as likely to have a crisis. And then, of course, you're going to hear from our amazing panelists who are living the life and can tell you about the other types of curative therapies that are available. So there are symptomatic things that we do, and then there are specific therapies that are targeted to try to shift the curve of the types of hemoglobin. And then there are gene editing types of treatments that are being done now. So addressing the actual issue, which is an abnormality in the genes. So going in and cutting literally and replacing with a normal sequence of amino acids so that that issue doesn't continue in the individual. So those are a few of the new things that are available. Happy to, we're going to have questions at the end.
Thank you so much. So I'm going to turn to our amazing panelists, Constance and Chris, to share a little bit of their story with sickle cell, but also if you can share with us from your perspective why it's so vitally important that the Black community participate in the clinical research to help develop new therapies, because we do need new and improved therapies for sickle cell. So maybe, Constance, if we can start with you, Chris?
Ladies first.
Oh, that's what we do.
I'm a Southern gentleman.
Yeah, you are. It's cool. He right. I know him. So for those of you who have never seen or heard of me before, which is cool if none of y'all do, because y'all know me. It's fine. My name is Constance D. Benson, and I am the first person cured of sickle cell disease under the STRIDE HCT bone marrow transplant study. Thank you. At the time when I had my bone marrow transplant, I was 25 years old. The reason why this is so important to me, sickle cell disease is so important to me, is because I would not be alive today if I did not have my bone marrow transplant. Everything was going so bad for me health-wise and so fast, and my disease was it was changing and evolving, and every day I would wake up in pain. I would go to bed in pain. The only time that I had peace, the only time that I could breathe was when I slept, because when I went to sleep, I didn't feel anything. So clinical trials, bone marrow transplant, sickle cell advocacy, all of this is near and dear to my heart, because I know that I would not be alive today if I did not have my transplant. And the thing is, it was nothing but God. My little sister was 100% match for me. Yeah. She had 10 out of 10 genetic markers that matched perfectly for me. And I would not be here today if I didn't have that bone marrow transplant study. And the thing about it is, when you're the first person, you are the first person. There is nobody that you can talk to, nobody that you can ask how it went. As a matter of fact, they tried to get me to talk to go to different cancer groups and talk with them before I went into the transplant to try and get an idea of everything, but I didn't. I'm like, I don't want to hear your problems, and plus we not fighting the same battle, so it's good. I'm good, baby. I got the blood of Jesus, okay? But anyway, so sickle cell is very near and dear to my heart, and there's a lot more to it, but we'll get to it. I need to get to Chris, the gentleman. Put it on the floor.
Yeah, first of all, big hand for Constance here. Yes. So very similar to Constance, growing up, I wanted to play sports. For me, my goal was to be a baseball player, but that quickly went out of the way. But very much like Constance, my little brother I'm 5 years older. He's 5 inches taller. I don't know how that worked, but again, genetics. Same genetic markers. My brother was 100% match, and he is my bone marrow donor. So I'm very, very grateful for my little brother. Yes. And so, I think that it's important for us to go through these trials, much like Constance. We were kind of the first. There was like 3 of us kind of going through it at the same time. We were kind of about a month or so apart, but we just really didn't have that community to really talk to each other to kind of figure out what was going on. How do we navigate this? Just a lot more questions than answers. And so being in this space now, we're able to pass that torch and say, hey, I've done this. Here I am, Exhibit A, that you can do this. And it's incredibly important that we in this community need to be a part of this and need to help each other out. Okay. For me, the clinical trials are extremely important. We know the history of the healthcare system and the Black community, but we've got to be able to go out there and step out on faith and say, hey, these doctors, if you can give me all the correct information, let's go out here, let's try it, let's trust it, because we didn't know when we went through this. And so, I'm incredibly grateful for my family. My mom is here. I'm just going to give her a thumbs up, because if I go into it anymore, she's going to start crying. But I am incredibly grateful for my mother, because she was there every step of the way throughout this entire process. And so she is my rock. We go through this all day, every day. So I'm incredibly grateful that this summer will be 25 years that I am sickle cell free. Yes. And so, as it relates to sickle cell, I am here in the community. I will always continue to be an advocate. So my girlfriend, my partner, she is also a warrior, and so we're also doing this together. So I'm extremely glad to be in this space and always help anybody out anytime that I can in this space. So thank you.
Thank you both for sharing. It's amazing. A round of applause. This is... And Constance, for you to be the first person, because of clinical research, to be cured, that's phenomenal. And the first person I've actually met who was the first person, because we have a saying, and Casey knows this, that the first person cured, or the first person to experience a better therapeutic treatment is somebody in a clinical trial. It takes far too long for us to develop medications. And a lot of that is because we don't have a lot of participation. So participating, not only are we helping to make sure that the medicines we develop, that we have the right information to answer the questions that Casey asked for her mother, but it also speeds, because there's a lot of people that are waiting for better treatments, waiting for cures, and they're having to wait far too long. So the more of us that participate, the better it is for all, because it really does bring hope. But we do say the first person to benefit is somebody who's been in a clinical trial, and you actually are an example of that. So thank you so much.
Thank you.
So you may be thinking, well, how do I find out about clinical research? How do I find a study? How do I know if there's one available? And I'm looking at Dr. Lovey here, who's shaking her head. Yes, one of our fabulous clinical researchers here in the city of Atlanta, working in the community. There's many ways that you can, obviously you can speak to your physician, advocacy organizations, community-based organizations, they often have information. But online, if you happen to go to Ponce City Market, you may see a beautiful exhibit that's sitting out there. It's called Reflections. And it's been brought to you by what we call a collective, because it's a lot of us getting together to address some of the real challenges and barriers that are faced by people who have the opportunity to participate in clinical trials. And it's called Reflections because we all believe that we should be reflected in clinical research. And so if you happen to be at Ponce City Market, it's a very interactive exhibit that talks a lot about clinical trials. But through the collective, we have a website. It's called BeReflected.org. So www.BeReflected.org. You can go there to search for any indication, and it shows all of the clinical trials actively enrolling specifically for the city of Atlanta. So that is one opportunity. So, Dr. Pimo, maybe I can turn it back to you. When you talk to people about joining clinical trials, what are some of the questions that they have most commonly? And perhaps you can answer those for us.
Thanks for that question. I think one is, maybe people are wondering here, if you want to find out what clinical trials are going on, where do you go to find that information? There is a website called clinicaltrials.gov that you can go to for any health condition. You can put the health condition in and say actively enrolling studies, and you can put in your zip code, and it'll tell you what studies are going on in that particular health condition that you're interested in and is enrolled and where the enrolling sites are. So that's one way to find that information. The kinds of things I've had conversations with people about that surprise me is the idea that when someone makes up their mind that they do want to take part in a clinical trial, they are challenged by the idea that there is a qualifying process, that you get to go through screening and eligibility to make sure that you can participate. So people always wonder what that is. And depending on what their experiences with healthcare have been, they sometimes come to it with some anxiety. The reason that eligibility is a thing is because clinical trials are an experiment, and you have to be sure that the people that are going into it are targeted so that we can figure out whether the intervention works or not. So that surprised me when people had that challenge. I don't know if you guys, what your experience was with going through qualifying or eligibility.
There were a lot of tests. I saw a lot of doctors. I had to get a lot of sign-offs. But yeah, I did experience that. I thought I was like, hey, I qualify. I have sickle cell, SS. Come on, like, I should be cured of sickle cell. And it was like, no, baby. You got to meet a cardiologist. You have to meet, God, it was so many different doctors that I had to meet in order for them to all check off on me, in order for me to give their approval, in order for me to get the bone marrow transplant. But I can honestly say it strengthens your resolve. It's like, as you're going through these appointments, you want to do it. It keeps growing in you. You're like, you know what, I do want this. Because if you want to be honest about it, I'm going to be completely transparent with y'all. If you want to be honest about it, I was in complete denial of my disease. I did not realize how bad it was. Both of my parents are nurses. And I've been blessed to have parents that are nurses. And when Chris was talking about his mama, there's nothing like your mama to hold you down, especially when everything is going bad. My mom was told by people in the medical industry, it was obviously never you, because I would love you. I would love to have her. But my mom was told that my life wasn't worth saving. Yeah, and I'm glad she's only recently telling me this now. But when I first started out, I thank God they didn't listen to me, because Lord, I was delulu. I was in so much denial. I had landed, my dream was to model. Chris's was baseball, mine was to model. I wanted to be in New York in Fashion Week with Wilhelmina up there killing it with Naomi and Tyra. I mean, like, I never did get the little booty for the Victoria's Secret, but it's fine. I got the rest, I think. Anyways, I was at Georgia State, and I had to drop out of Georgia State for a semester because I kept getting sick, and my professor didn't want to acknowledge that I had a disability that was registered with the university. I kept missing days. I had a really hard time. People would say I don't look sick. And I was even told I was in a full-blown sickle cell crisis. And I was told when I was trying to catch in and trying to get help, I couldn't breathe. I was told by the lady, oh, you're too pretty to be sick. And then she went on to tell me about how she partied over the weekend, and I'm in the worst pain in the world. They don't see me. But with all of with all of the sickle cell pain crises and everything that I was going through, I still did not realize how bad my disease was. When I landed my modeling contract, I would drive 13 hours from here to New Jersey. Then I would go from New Jersey to Philadelphia, which is where I had my modeling contract. Then I'd come right back and I'd go straight into the ER, or I'd go straight to pain therapy. And I did that for about 9 months. And it was worse and worse, and it just kept getting worse and worse. And by the time I was at my worst, I was on 150 micrograms of fentanyl patches, which are 72-hour release. I had Dilaudid pills because hydrocodone was a joke and oxycodone was a tic tac. I got up to about 30 milligrams of oxycodone. I was taking this stuff every day because the pain was so bad. Everything hurt so bad. But if you look at us on the outside, you look at me on the outside, you never would have known anything was really going on unless you knew me. The pain was bad, but I was still, I had sickle cell. I was born with sickle cell. I'm not a quitter. I'm a soldier. I got this, you know? I can deal with this. That was my mentality. I did not realize that it was getting to the point where I couldn't deal with it, and this was actually really bad, and my health was declining, and I was dying. After about 9 months, I was in the hospital at Kennestone, and my agent had called me. Never in my life was I ever afraid of telling people that I had sickle cell disease, but I never told my agent because I didn't want anything to keep me from landing my modeling contract, which was my dream. I was in the hospital, hooked up to a Dilaudid PCA, getting push IV of Dilaudid and 50 milligrams of Benadryl to help with the itching. And no lie, my bed was right here, and then the bathroom door was right there. My agent calls me and tells me, "Hey, I need you in Philadelphia. No, I need you in New York. This is your opportunity. You're gonna audition for a Wiz Khalifa video." I was like, "Okay, bet, I'm there." I'm hooked up in the hospital, full-blown pain crisis, and we just got it under control. So I tell my doctor, "Hey, disconnect me. I need to go up there." And she's like, "Are you psycho?" No. But I fought her, and they took me off, and I didn't make it 6 feet to the door. I had to come back and call my agent and cry and tell him I had sickle cell disease and that I couldn't make it. And that was the last time I ever heard from him. From there, it got worse. It wasn't manageable. My parents, I thank God for my parents, my mom and my dad, because they saw what I couldn't see. And when that opportunity presented itself for me to have this clinical trial, this transplant, they were on it. My family is the one that pushed me to get it because I didn't think that I was as bad as I was. And fortunately, by the time I realized it, after going through all those appointments just to humor them so they would leave me alone, fortunately, by the time I realized it, I had approval, and I was there. It was time for it. But if I had waited till I really, really, really wanted it, it would have been bad. So I wouldn't be here. I know that was a lot, y'all. I'm sorry.
Oh, it's okay. We need to hear those stories. We do. So, yeah.
Thank you.
And I think for me, to be honest, kind of like Constance, I originally didn't want to do it. You know, I'm 15, 16 years old, and I just want to live a normal high school life. And for us, that's really kind of out of the question. But, you know, I'm 16 and, you know, talking about a bone marrow donor, if my brother's it, and he's 11, and, you know, he had hesitations as well. And I certainly get that. He's 11 years old. So, you know, having those conversations with our families was extremely important. When you're going through something like this, you have to have a village, okay? And I get some people may not be close to their families, you may not be close to your kinfolk, but you need family. And that's how a lot of people have gone through these transplants and gone through these clinical trials. And so I am very grateful for my family. They came down every day. You know, one of my cousins was like, "Hey, we got to get up, we got to go walking, we got to do this, we got to do that." And so I am extremely, extremely grateful for my family. So anytime that you're going through something like this, you know, make sure that you have your family with you, make sure you have your rocks with you, because these are extremely tough procedures and tough times. And so you've got to have some real conversations with some people about what's going to happen here, because being in this space, now that we've gone through it and we've been successful, we've had conversations with other people considering transplants. And we're very real. This is a very serious medical procedure. So think about everything that you want for yourself on the other side of this. Do you feel like you can do that? And I'm very grateful that I'm talking to other people who have gone through transplants and they're very successful in their lives now. But going through it is tough. But when you come out on the other side of it, it's a beautiful and blessed experience.
Thank you. So we're going to go to questions, but first, Casey, Dr. Pimo, Constance, Chris, thank you all, but any final words before we go to questions?
I just have a comment because what you guys have really shared is the importance of community. And I think that's really, I think that's a place where we're trying to say, how do we create community around medicine? How do we make sure that the things that you needed were there for you? I don't know if you guys saw my 3-year-old doing the ab workout, but he's here because the babysitter's not, and I think those are real things that our families go through. And so I think hearing from you all and what are the things that you need in order to participate on clinical research is really important for us as researchers and as an organization so that we can meet you where you are and so that you guys blaze the trail, but we don't want you to have to go through those things alone. We don't want you to have to only depend on your family. The entire community of the healthcare should be there for you as well. And so, my request is for any of you, talk to us, tell us the things that you need, tell us how we can be a part of your journey, because we want to be able to do that for you.
Thank you. So if the AV team, I believe we have our second QR code, if you could put it up. If you don't mind, this is a follow-up survey, just to understand some of the questions you may still have. Thank you all for the story and a testament to the miracle of clinical research to science. Right here. Thank you very much. And just a reminder, if you don't mind with the survey, thank you all for coming. And to everybody who participates in clinical research, thank you. It's because of you that we do have better treatments and cures.